Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And today's topic, it's going to leave a mark.
It is, permanently.
Permanently so. Piercings, tattoos, how would you characterize the topic? What is the unifying factor?
Things that you should know before you get one, just to consider, because there's medical things that affect how the end product ends up.
Okay, but specifically talking about piercings and tattoos.
Piercings and tattoos.
Okay.
And so this is so not a lot of dismal information that's going to shame people for having tattoos. I don't know why doctors have that reputation or healthcare providers have that reputation. We don't. We're neutral about them. But there are some health considerations that even I didn't know about, actually, when I was researching this. So,
okay.
And lots of people have them. So about 20 to 50% of young adults have them. And this was interesting to me. Only about 4% get them removed.
Yeah.
So if they have one they grow out of or don't like, or, was for some nefarious reason. Some people are tattooed, in the sexual slavery trade and stuff like that.
Uh-huh.
But only about 4% get them removed, which I thought was kind of interesting.
Huh. I don't know. That doesn't seem weird to me, because tattoo removal is something that's relatively new, at least in my life.
Right.
In my lifetime,
it's
it was a big
expensive
deal.
and it's considered cosmetic, so maybe it's a financial thing.
Okay, all right. Maybe that's where it's kind of marginalized.
Maybe that's what it is. But I've seen a lot of tattoos in my life, and some are really beautiful, are total artwork, definitely, and some are like, what were you thinking? Was that like a Margaritaville night, or like what was going on? So, and people mostly get them, no big surprise, to either define who they are personally or to decorate their bodies. So they're also influenced by personal narratives. Those are more memorial, tattoos, like my girls are thinking about getting after their grandmother passed, and or influenced by friends, like, we'll all get one. So, but here's some things to consider beforehand that I didn't know about. Okay, so some acne meds will slow healing, so make sure your tattoo artist, number one, is professional, number two, is using the proper equipment, and number three, that equipment is properly sterilized. Okay, we're going to start with that foundational base.
And is there? Do you have any guidelines as to how to you just Joe untattooed person walking in off the street, how you can look at something and judge whether or not it's clean enough for tattoos?
Well, they usually take it out of the sterile packaging. I think that's pretty convincing.
Okay, so look for
And always when things are sterilized, there's a little tester in it, like a strip that indicates that it got to the right temperature for the right period of time.
Okay.
So you can ask to see that.
Oh, wow.
Okay. So
I'm pretty sure my daughter has a tattoo she got in a bodega in New York City. And I'm not exactly certain how many of those protocols were being followed.
When I was the parent on board, when my kids got tattoos, especially when they were under 18, tattoos and piercings, I was standing there watching them take it out of the sterile package.
Sure.
So I think a lot of tattoo artists and a lot of piercing artists do that. You probably should go to somebody who's reputable, not like your friend's cousin who's doing it out of his bedroom.
Yeah, right.
Because he doesn't have a sterilization machine. But things you should consider beforehand. Some topical acne meds slow healing. I didn't know that. And then some people get what's called keloids. And, we've all seen these on people and probably didn't know what they were. But that's a really big scar. That's like on steroids even. Really big, puffy, looks like whatever the wound in question didn't heal well. And by the time somebody's, 20-something, they kind of know whether they get keloids or not. I've seen them from acne. I've seen them from lacerations. I've seen them from mosquito bites. And there's no way you can change your genetic destiny if you get keloids.
I'm lost. I don't know if I know what a keloid even looks like.
Well, while you're Googling it, it's so let's say you get a laceration on your shoulder, and it's a healing response with a really prominent scar that's super puffy and super wide, and so wider than the laceration, sometimes longer than the laceration, and definitely looks like kind of a weird, deformed, squished marshmallow.
Okay,
It's
so
adherent to your skin.
like an abnormal amount of scar tissue, maybe? Is that
Right.
what it looks? Okay.
And if you
okay.
choose to get it removed, first of all, it's considered cosmetic, so that's hard to do. Sometimes they inject them with steroids. But if you get it removed, the trauma of removing it causes the keloid to reform
Right.
because that is how your genetic destiny
Yeah.
heals your wounds.
yeah.
Okay. And I've seen like pretty horrific ones. And, people by the time they're young adults, they know if they get them. All the usual boo-boos that they got growing up have kind of this aberrant healing property, and they'll bring it up to their provider, and their provider will go keloid. It's not anything dangerous. It's just unsightly.
Sure.
Yeah.
But it doesn't go, I mean, because you're going to get some scarification from tattoos and piercings and things. So,
And so let's say you're getting a delicate lily, or something, and really how it heals up, it's like this big puffy squish thing.
yeah, right. Okay.
Yeah. So, keloids or tattoos make it hard to monitor for abnormal changes in the skin. So let's say you got a bunch of sunburns up on Second Bridge as you were growing up, and you have a risk factor for skin cancer. It might be hard to keep an eye on your skin when it's tattooed over.
Right.
Okay.
Yeah.
So that's kind of a problem. Infection, of course, pretty common, and I've seen that appear commonly. When we were in kind of the MRSA epidemic time, it seems like that's calmed down a little bit, but a lot of tattoos got secondarily infected with MRSA, and that's a nasty
No,
infection.
you're right. I haven't heard a lot about MRSA recently for some reason.
Yeah, I don't see it very often anymore. I see little waves go through the
Right,
community, but
right.
not like it was
Yeah.
when it first hit town, I guess.
When MRSA hit down.
I know. I put kids through college on MRSA, let me tell you. Because doctors at the time, they didn't know what it was. They were a little afraid of it, and they sent it all to urgent care.
Oh.
And then there's something called Kubner's phenomenon, which is kind of associated in my mind most clearly with psoriasis. And so that means that the abnormal skin change happens where there's trauma.
Okay.
Okay, so it could be trauma like a mosquito bite, and all of a sudden you got a psoriatic lesion there. Or it could be a tattoo or a piercing, and all of a sudden your psoriasis flares up around it.
Wow.
And I hadn't really considered that, but I actually have seen it without being super focused on it.
What's it look like?
It looks like a really hideous painted over, because it's usually tattooed over, right? So there's a color involved. Psoriasis lesion. So
Wow.
it's thickened skin. It's got a silver scale, and it's irregular and red, and looks like something that somebody who isn't knowledgeable would be a little afraid to touch.
Wow. Okay.
Okay, it's not contagious. So those are some things to think about ahead of time. And you can talk to your provider or your tattoo artist, I suppose, but providers, apparently there is such a thing as a pre-tattoo consultation in medicine.
Really? Oh, wow.
Yeah, there's ICD-10 codes for it and stuff.
Huh.
So the risks after you get it can be localized infection like MRSA. We touched on that. Chronic viral infections like hepatitis B, hepatitis C, HIV, and Mpox. So there's been descriptions of Mpox infecting the actual tattoo site. It doesn't really become systemic. HIV, of course, is systemic without an immunization. Hep C is systemic without an immunization. Hep B is systemic but has an immunization. And most people in their early 20s are probably immunized if they were standardly immunized.
Did you say HIV has an immunization?
Does not have an
Oh, okay.
immunization.
Okay. That's what I was wondering. Okay.
I think they're looking at it, but not really finding it yet.
Okay.
And then here's one that I should have thought of is endocarditis. So anytime that you're pushing bacteria through the skin, you can push some of the bacteria into a blood vessel, and if you have an abnormality of your heart, or even if you don't, it can settle on your heart valves.
Oh, wow.
And it makes a really what we call fungating lesion, which looks like a big wild fungus.
Ew.
And of course, it keeps your heart from beating normally. And that's a huge, big problem. Sepsis, and I mentioned this one because this is specific to Vibrio, which is found in seawater here, and a lot of people bathe their wounds in seawater because their grandma told them to do
Oh,
it.
because of the salt, thinking that it makes it...
Big mistake.
Really?
Yeah,
Oh,
don't do
wow.
that.
Okay.
Don't do that. Vibrio is a really nasty bug, super common. And I don't know that necessarily providers would think to treat for that. They might automatically go in on the MRSA plane and not ask if somebody's, been bathing their wounds in salt water.
Right. That might not be readily like
Right.
evidence.
It's something we think of with sea lion bites up here, which is actually a thing.
That's a thing? Getting bitten by sea
It's
lions?
a thing, yeah.
Wow. Oh,
Yeah.
wow. In the water, or from people going up to them at
All
the
of
chart
the
room?
above.
Really?
Yeah.
They are big dogs.
Yeah,
Don't
they
do
are,
that.
and they don't get rabies as far as I know, but they get also a lot of other nasties. Allergic reaction, which I have seen to certain, people have a colorful tattoo and maybe a specific color will show up with an allergic reaction. So,
Because each ink is made with different components, right?
Right.
Yeah.
and I think somebody told me once that their tattoo artist said that they had organic ink, implying that it was somehow better. That's not a thing. That's not a thing, not necessarily better. But the good news is no clear cancer association. Because I was told a long time ago at a conference that black ink could be associated with increased risk of melanoma, but
Really?
they're not saying that anymore.
Huh.
But red ink does have a really, really, really low risk with squamous cell carcinoma.
Really?
Yeah. So probably your risk at second bridge of getting sunburn peeling when you were 10 years old is a higher
It's more
risk
than
for
that,
that
but
than
that-
this
okay.
is. So nobody needs to get too upset about that. There is some pain with MRIs because some of these inks have metallic bases, right?
Wow.
And so you get a burning of the skin with MRIs.
Oh my gosh.
Yeah.
Is it damaging or just discomfort?
No, it's just owie.
Yeah. Okay.
So that's something to consider. And then,
That's a nursing term.
yeah,
It's a PA term. Owie.
Owie,
Owie.
yeah.
Okay.
then low risk of complications with epidermal anesthesia. So what we used to call tramp stamps is right where somebody perhaps in labor would be
Right.
getting epidural anesthesia.
Right.
And so if you're pushing a needle through a tattoo or you're pushing the ink into your cerebral spinal fluid, I think they could compensate for that really easy and just kind of what's called Z tracking, just move the skin out of the way.
Oh, right.
Yeah,
Okay.
I don't think that's a huge big deal either. So we already said if you're going to get a tattoo, what should you look for? Look for a professional with proper sterile equipment. Okay. Consider getting immunized for hepatitis B beforehand, which most people already are. Pay attention to what you're told for aftercare. Even if your grandma says, go hit Pebble Beach and stand in the water for a while, don't do that. Do what your tattooist is telling you to do, and do what your physician is telling you to do. And they say no seawater for 2 weeks,
Okay.
which is kind of interesting. So I have seen a lot of tattoos that were infected, especially in the MRSA days, and that they were easily treatable. But there's always an argument between the tattoo artists on what you do and the provider. So we go back to the data-driven. You going with data-driven, or you going with somebody who's selling you something? So your choice.
On top of that, too, do you know, are tattoo artists required to have any sort of training whatsoever for certification
Not
of any
that
kind?
I'm aware of, but I bet somewhere it exists. Probably different from community to community. Probably tied to a business license somehow. So
I got to look into that because that's it. I mean, that's interesting. There's so many stipulations here. I just really wouldn't like, I'd like the person giving me a tattoo to kind of know these.
Right.
That'd
You
be
know these
nice.
things, but they also don't necessarily believe medicine. So, there's oftentimes there's arguments back and forth about how to take care of a problem.
Well-
Does that need antibiotics or not, or should you change the dressing or not?
And again, if somebody's properly trained, then that shouldn't matter. It should be like, watch out for this.
Right.
And then however you want to deal with that, but watch out for this. If
Right.
if your arm you start looking like the
Right.
elephant man, it's not good. Don't go in the ocean. I don't know, but just something,
Totally.
some sort of knowledge.
And then the last part here is about piercings. A lot of people have piercings. I started seeing piercings when I was working in the Castro. And one thing you might consider with a piercing is sometimes piercings, if you leave them in during an x-ray, you obscure the area you want to look at in
Sure.
the x-ray detail. So it annoys radiologists to no end, and they probably have a point there. Because they're looking at tiny little areas, and they want to be thorough. About 35% of young people have piercings other than their ears. So if you take ear piercing into consideration, it's probably almost 100% of people, I would think.
Right.
Yeah, a lot of infants get ears pierced before they're old enough to know better. And then they have similar reasons. People have similar reasons for getting piercings, but this also includes sexual expression. So there's a lot of piercings that are genital that are tied to certain sexual practices, and that's all I feel like I can say about that. But not being a super duper expert, so although having come across it in my medical career, so,
Yeah, sure. I imagine you must have seen things, right?
So if you have questions about that, go ask your mom, I guess. But people with congenital heart disease, and actually I've run across a couple lately. It's not that uncommon, but they run a significant risk of this infection on their heart valves when they get pierced, especially with oral piercings. And I could totally see a 17-year-old with a history of tetralogy of Fallot, which is a congenital heart abnormality, even surgically corrected, most of them have to be, and just deciding to get a tongue piercing because, their friend was getting one.
Sure.
And
Not even
having
thinking.
it be like a huge big deal. And I don't think people are told that.
No.
So if you have any kind of heart abnormality, like congenital anatomical heart abnormality, then you probably shouldn't be getting a piercing, especially an oral one.
Does it also follow that if you have that sort of abnormality, any sort of infection is going to be problematic for you?
Yeah.
Yeah.
And
I
so
mean, if
you
it
know
gets
how
in-
they have to take antibiotics before dental cleaning? It's a thing. It's a real thing. And I suppose if you had to get a piercing, you could try taking antibiotics, but there's no approved way of doing that. So
Right.
I think that's super dangerous
Right.
and probably not to be advised.
Interesting. Okay.
Yeah.
Okay.
Also, you can get keloid formation, those weird, ugly-looking scars. Well, what if it was in your tongue?
Ew.
Yeah.
Ugh.
Yeah. And then also what I've seen a lot are allergies to nickel, and this is oftentimes in ear piercing. A little kid will get have your pierced ears, have a change in earrings because they got something for their birthday, and then their earlobe swells up. And the backing, so I'm talking about posts here with a backing, it gets swallowed up into the swelling of the earlobe.
Ow.
And it's super hard to take out. I had to take one out of my daughter's earlobe, and I waited until she was asleep, and she's a pretty heavy sleeper. So I was super lucky.
Oh, wow.
But it's very hard to hold down a screaming 3-year-old to try and take a piece of metal out of the inside of their earlobe.
Right.
So I would avoid nickel. And in my reading, it suggests that even if you're getting stainless steel, earrings, that you still have problem with inadvertent contamination of nickel, and that can still be an issue.
I'll be damned.
Yeah.
Huh. Is there something just about nickel that's more toxic to people?
It just stimulates the immune system, like belt buckles. People come in with a rash where their belt buckle hits them.
Uh-huh.
You know, they've been wearing the belt buckle for like 10 years. It's never done that. They've just slowly developed a nickel allergy.
Wow,
And then you say,
wow.
take the belt buckle off, and they're like, no.
No. I won this. Yeah, no, I know what you mean.
Yeah. So I found interesting. Aftercare for piercings should be antibacterial soap twice a day for 10 to 15 days. I don't know how you do that on your tongue. Maybe hydrogen peroxide, water down swish. Oh, no, they said diluted Listerine.
Diluted Listerine.
Listerine,
Okay.
yeah.
Because, Listerine's just basically floor cleaner, right? Yeah.
But here's the deal, is that the piercing professionals sell aftercare products that are, likely to be contaminated and are not really addressing the common piercing-related bacteria. Mm-hmm. So, again, I think providers have the upper hand on this. They're not trying to sell something, really. They're just trying to, make it so your tongue doesn't swell and cut off your airway. Right. So, it would be good to, I think, listen to providers on this one. You can talk to your provider about it. Up to Date has all the information you could possibly need. And then the other thing, just risks, again, localized infections. And I would say high on the rim ear piercings.
Like through the cartilage?
Yeah, or tragal. That's through the cartilage. Cartilage is poorly vascularized. So if it gets infected, it's a super nightmare to try and get healed.
Oh, wow.
And because a lot of the commercial products to clean are contaminated with a specific germ called Pseudomonas, that would not be a germ that I think average provider would jump on first. We would go staph strep. So maybe MRSA, maybe the strep that lives on the skin, and stay away from the actual medication that helps against the Pseudomonas organism.
Oh, wow.
So this was one thing I didn't know, and I've been merrily treating it with the wrong antibiotic.
I'll be damned.
Yeah,
wow, this is
so
you learned this from
now I
researching
know.
this episode? Wow.
So if there's a localized infection, recommended, especially in the ear, recommended treatment is with ciprofloxacin orally because it's a big deal. And then topical anti-staph medicine, usually mupirocin, which used to be called Bactroban.
Bactrobe, okay.
Which is not Bactrim, which is not bacitracin, it's mupirocin. Okay?
Okay.
And everything has to sound the same and have three names. But
right,
anyway.
and all mean something different. Yeah.
And so consider that you also have risks in piercing for HIV disease, hepatitis B, hepatitis C, and Mpox. And take precautions. There's immunizations available for 2 of those. And then make sure you have sterile equipment. But nobody should freak out, and I'm talking to you, Denise. Nobody should freak out. This is like a little bit of knowledge ahead of time is a really powerful thing. And then when you go, if you do have a problem, see your provider, because some of these problems can be pretty big. And if they don't seem to know what to do, it's super easy to go into the medical library and figure it out. None of this is hard medicine. It's just surprising medicine.
Why? Why is that? Why surprising? How come you didn't know this? Was it a cultural thing with just because tattoos, that's something that's kind of reasserted itself in our culture just during my life.
Right. I think because science changes over time, and I think we're just seeing new recommendations. Also, this is a specific thing in medicine, and I think most medical providers use a generalized knowledge base.
Good point.
And they don't really spend enough time getting history and really figuring out, really, you use the stuff that he sold you? Well, then you're at risk. Boom, boom. What? You went in the beach? You went in the ocean? Boom, boom, boom.
Yeah.
There's considerations for all of that. And I think any family practice provider could figure this out easily. And of course, once they have some success, then they're going to repeat that if they come into the problem again.
Now, I know you don't have any tattoos. You shared that last week.
I have piercings.
You have okay,
but
so
ears, just ears.
Just ears.
Nothing exciting.
Nothing. So what would you do?
What?
I mean, if you were, I guess it also that this means you kind of have to imagine yourself making a decision based on you being a different person, right?
Right.
But okay, let's say your daughters were much younger, and I know that that they have gotten tattoos and
I
such.
did
but,
I took my daughters when they wanted piercings. Let's see, what did they want? They wanted, like, I think it was an eyebrow piercing. And I happen to have friends who owned a tattoo place in Humboldt County, and so I worked with them at Open Door. And so I talked to them about ahead of time. So that's kind of unusual. So
Yeah,
I found
yeah.
a reputable person that I could talk to that respected where I was coming from, that encouraged my kids to listen. And then my kids did listen because, you know, he was supportive of, we kind of came at it as a common front. So I was involved in all their piercing stuff until they moved out of the house. And then there's stuff apparently I don't know about, and I'm trying not to think about. But I know you feed them organic baby food and you fret about their nursery school, and then they go out and do that to
they
themselves.
go get like a strip mall tattoo. Yeah, I know. That's what.
Right. And I just quietly research, and if they need help, you know. So that's kind of what I did. I just kind of got involved. Now, as far as the tattoos and stuff, I just gave them, I don't freak out. I'm not anti it at all. I just said, you know how sometimes you dangle advice in front of a kid and pretend like you don't really care about the outcome?
Right,
And
right.
then they're more likely to go for it.
Yeah, if you don't make a
yeah.
big deal out of it,
Yeah.
then
This is, I wonder if that was sterilized equipment. Oh, well, I'm sure you made the right decision. You know, so, you know, I've got one daughter that's covered in piercings and tattoos, and one who's almost 30, and she just got her first tiny little memorial tattoo to her grandmother. So, and they got piercings, and the younger one, when she got a tragal piercing, that's the
ear thing.
Yeah, the ear thing. That's
I didn't know that had a name. That little lobe out front there.
right.
Yeah.
So, you know, I said, look, that's mostly cartilage, and you're going to, you know, you should consider this. And she, you know, she's in medicine, and she took it to heart.
Wow.
So, and then she got a little preauricular node, which is a little lymph node right in front of it. And I said, okay.
I'm not saying anything.
I'm just, my gosh, how did that happen? Who could have seen that coming?
Yeah, if anybody could.
Yeah. So, you know, and then she got through it and it was all okay. So, I think if you're a parent and your kid is doing this, I don't think you ought to freak out. I think you ought to drop a couple really well chosen words of wisdom and then direct your kid to a tattoo place that's reputable, and make sure they follow the instructions they're given, unless they're ridiculous, like go swim in the ocean.
And you've got, I mean, and you had firsthand, you knew somebody you could talk to and
Right.
steer your kids to. What I could find online, just while we were talking here, was that it is, at least with tattoo artists, or I guess body art practitioner, they're calling them. So that
Okay,
could be
that's
anybody.
fine.
You'd register with your county.
Okay.
And this specifically, though, so I imagine each the rubric is different for each county, right? This specifically goes from Los Angeles counties, in which you have to show that you either have or haven't been immunized or gotten the vaccination for Hep B.
Right.
And you can show that you have been, or that you voluntarily declined it, but it's a conscious choice.
Right.
And then you have to have, ID and all that stuff. But then a certificate of completion for what's called here an approved bloodborne pathogens exposure control training course.
Right. And those are pretty minimal and they're pretty basic.
It's probably like what, a half hour online or something like that?
Totally.
Yeah.
Yeah. Maybe 20 minutes.
Right. You probably have to pay more attention to get your food handling license.
Completely.
Wow.
Yeah.
Okay.
So
that's what you're
Buyer
dealing with,
beware, I
baseline.
guess.
Yeah.
Yeah.
So you maybe develop, try to find, I guess, look for the more reputable businesses and things. You could look
I
at them
know
like
when
that.
when I picked the piercer for my daughters, because I was familiar with them, he did some intense stuff that's kind of around like sun dances and stuff.
Okay.
And so he had pictures of it all over the wall. And my kids, all of a sudden, I got cooler because I knew
'Cause
someone who
you knew
was cool.
that helps too.
Yeah, but he was super helpful, and he also, he's got piercings all over his face. I mean, he's definitely in the business, and he's definitely knowledgeable, and he's definitely respectful of the medical community.
Excellent.
So it worked out well for me.
What is up next? We are now out of time.
Okay, functional medicine.
Functional medicine.
It's kind of coming into Del Norte.
Funk-
What exactly is that?
Yeah.
Why would somebody provide that kind of medical care?
Okay. All right. Well, I'm already curious. I'll look forward to that.
Okay.
That's the next Health Matters. Lynn,
Yep.
thank you.
Yeah, thanks.